Why do older people nap so much during the day? Why do you wake up so often during the night and then find that your sleep is not as restful as you would like? What is the typical night of sleep for a person over age 65? These are all questions that I've heard frequently in my clinical practice. Hi, I'm Dr. Maria Conley, and I would like to talk to you today about how sleep changes as we age, particularly once we are over the age of 65. We'll talk about what changes are normal and what other medical conditions to look out for that can also affect your sleep. So let's talk about normal sleep. Normal sleep is made up of non rapid eye movement. For the purposes of talk, I'll just call it non REM sleep. This is stages 1, 2, 3, and 4, and rapid eye movement sleep or REM sleep. Throughout the night, you progress through several cycles of sleep. You begin sleeping in non REM sleep, stage 1, and then you enter deeper stages of non REM sleep, including stages 2, 3, and 4. Then you begin your first episode of REM sleep, which typically lasts for about 10 minutes. This is considered one sleep cycle. Each sleep cycle lasts 90 to 120 minutes. You go through several sleep cycles throughout the night. Over the course of a night, REM sleep usually makes up 20 to 25% of total sleep and typically occurs in 4 to 6 separate episodes. Non-REM sleep usually comprises 75 to 80% of total sleep in most individuals. So just to recap, a sleep cycle starts in stage 1 and then usually progresses through stage 2, stage 3, stage 4, and then into REM sleep. After this, you go into another sleep cycle, and this repeats until you stop sleeping. Researchers also have used brainwave patterns to describe certain stages of sleep. For example, stage 3 and stage 4 are known as slow wave sleep, based on the appearance of brainwave tracings captured while a person is sleeping. In the first half of the night, you will typically have longer periods of slow wave sleep. And in the second half of the night, you'll be getting longer periods of REM sleep. REM sleep is timed with our circadian rhythm and body temperature. The body temperature tends to be lowest in the early morning hours, and this is when REM sleep is more prevalent. You lose your ability to regulate your body temperature while in REM sleep, although you are able to shiver and sweat during the other stages of sleep. So, extremes in ambient temperature may become more bothersome in the second half of the night when you spend more time in REM sleep and therefore cannot regulate your body temperature. REM sleep is very different from the other stages in the sleep cycle. In REM sleep, your brain is very active, but your muscles are temporarily paralyzed and you have frequent episodes of rapid eye movements. In contrast, you can move your body, but your brain activity is much more subdued during non-REM sleep. Again, this is stages 1 through 4. I find it helpful to look at the progression of sleep stages during the night by looking at a special chart called a hypnogram. A hypnogram is a graphical representation of the amount of time a person spends in wakefulness and in the different stages of sleep throughout the night. Researchers are able to discern what stage of sleep a person is in by attaching special monitoring devices to the body during an overnight sleep study. These monitoring devices tell us about the activity of the brain, the muscles, and the eyes while a person is sleeping. It is easy to see how the young and the old sleep differently throughout the night just by looking at their hypnograms. The elderly have more periods of wakefulness and less time spent in slow wave sleep of stages 3 and 4. Age is the most important factor affecting sleep. Overall, individuals over the age of 65 have decreased slow wave sleep in stages 3 and 4, and they also spend more time awake after initially falling asleep. In fact, by age 60, some men may no longer have slow wave sleep at all. Women tend to maintain slow wave sleep later into life than men. The amount of REM sleep only decreases a little bit as we age. It's important to recognize that sleep becomes less efficient as we age. Because older people have so many more nighttime awakenings, their sleep is very fragmented and often not as restful. As we get older, underlying medical conditions such as obstructive sleep apnea, restless leg syndrome, and bladder problems become more common. Obviously, these conditions can also cause you to wake up more frequently throughout the night. Older people also frequently take medications which may affect their ability to sleep. Many older people, though not all, experience increased daytime sleepiness and need to nap. Daytime napping is most likely a result of decreased sleep efficiency during the night. Older people have changes in the sleep-wake cycle, meaning that they are less likely to have long periods of restful sleep at night and then long periods of wakefulness during the day. Frequent nighttime awakenings, interrupted sleep at night, and more frequent daytime napping are common in many older people. It's okay to nap. Studies have shown that daytime napping in old age does not adversely affect sleep at night. It is important to see your healthcare provider if you feel that you may have an underlying medical condition such as obstructive sleep apnea or restless leg syndrome, which can make the quality of your sleep worse. There are effective treatments for these conditions. Now that we have reviewed how sleep changes as we age, I hope that you have a better idea of what is normal and what to expect. Thank you.